Introduction. Seeking help from specialists with a complaint about a sudden decrease of vision in one eye is a serious reason for nursing intervention, since the patient experiences discomfort and is temporarily forced to adapt to a new lifestyle. As the subject of intervention, 32-year-old teacher Jessica is considered. She has vision problems in her left eye and needs medical supervision. Nursing care for Jessica cannot be carried out on the basis of standard rules of assistance, and the corresponding diagnoses should be determined. Therefore, nursing diagnoses include anxiety associated with the alteration of the perception, as well as a self-care deficit caused by a sudden decrease of vision. Alteration of the perception of surrounding evidence, teaching and nursing care plans. As a rationale for choosing this diagnosis is the woman's need to adapt to new conditions and partially change her ordinary daily regime. Weakened vision creates serious hindrances in everyday life, and the patient needs to be able to adapt to temporary circumstances, trying to forget about her anxiety. Thus, as a teaching aid, it is possible to work with the woman, training her sensory skills and simultaneously testing the level of vision. For example, auditory reflexes can be useful in cases where visual images are poorly discernible. Also, it is equally important to recommend the patient audio literature where she will be able to draw useful information about the terms of the recovery period and necessary procedures. Nursing care should also be organized when taking into account the temporary disorientation of the woman. Despite the fact that one eye sees well, the other one gives inconvenience and pain sensations under tension. The eyeball should be kept at rest and controlled so that the patient could not experience visual stress. According to Doenges, Moorhouse, and Murr, a sudden decrease of vision is a dangerous factor and can be the symptom of a disruption in the functioning of brain cells. Therefore, it is significant to give maximum attention to the patient in order to prevent the complete loss of vision. Self-care deficit, teaching and nursing care plans. As a rationale for choosing this diagnosis, it can be noted that the lack of an opportunity to provide oneself with a full-fledged care is both physical and psychological discomfort, and this approach is relevant in the case of Jessica. Weakening of vision even in one eye complicates the woman's life because visual perception becomes different, and some actions are unusual for the patient to perform. As Castellan, Sluga, Spina, and Sanson remark, the solution to this issue is one of the most frequent tasks faced by junior medical personnel. Therefore, having a good practice, it is essential to help the patient adapt to new conditions so that there could not be any serious restrictions on the way of life. For this purpose, the woman should be told how she can take care of herself and perform her usual actions without straining her sore eye. It is also possible to show her how to care for a damaged eyeball when medical personnel is not around. As a nursing intervention, it is required to provide the woman with real help in performing daily procedures, for example, in reading correspondence. A little fever may indicate an inflammatory process. Therefore, it is significant to monitor the condition of the patient's damaged eye, prevent direct contact with water during washing, not to allow any dust ingress. Conclusion. Thus, such nursing diagnoses as anxiety associated with the alteration of the perception and self-care deficit can be applied to the case of Jessica. Appropriate teaching and nursing care plans can help the woman to prevent the spread of infection and gradually restore her vision. Nursing control will be useful for the patient since her sore eye requires special care and protection from external stimuli. Study Corgi can help you make your studies smarter. Visit studycorgi.com for more samples like this, study tips, and writing tools.